to achieve our task. Thirdly, which many people will not know, I would like to thank His Excellency the Governor. From the time we took over, he was the Senator of Nairobi. He helped us guide NMS to what we have achieved today. So my thanks to the Governor. It's truly an honor and delight to be part of this historic event for our great city of Nairobi. Looking back, it has been a rigorous and remarkable 2 years, culminating to this very moment as we officially hand over the transferred functions back to the county government. As you recall, on 25th February 2020, Nairobi City County, via the deed of transfer of functions agreement, transferred 4 functions to the national government. And these were county health services, county transport services, county public works, utility and auxiliary services, county physical planning and development, and environment and energy. Arising from this transfer, NMS was established in 18 March 2020 as institutional framework to implement this deed of transfer. The deed was amended further to addendum to the deed of transfer dated 8 March 2022 that, among other things, extended the initial period from 24th to 24th August and provided a handover period of 3 months. Ladies and gentlemen, I'm happy to report that NMS has performed its task quite well across the 4 transferred functions in accordance with County Integrated Development Plan, resulting in tangible positive outcomes that many Nairobi citizens can attest to. Without further ado, I'll not elaborate the tasks that we have done. It is well covered in the report, but in the health sectors, remember we were formed under COVID and we had a stretch to extend the health facilities, especially in informal settlement. And I'm happy to report that we finished the 20 hospitals. They are fully operational and running, both level 2 and 3 facilities across all the marginalized areas and informal settlements. We have also facilitated the construction of additional ICU facilities at Mama Lucy Hospital, extra wards dedicated specially for COVID. We have also completed Mama Margaret Kenyatta Hospital that has been stalled for over 3 decades. Additionally, NMS, with the support of national government and in collaboration with other state agencies, oversaw the sinking of 193 boreholes in informal settlement that has eased the problem of water, especially in the marginalized and informal settlement. NMS has also acquired 29 water bowsers that has increased the much needed supply of water, as well as acquiring 13 new ambulances, which will help the county government in its health functions. Under universal health care, NMS has identified 326,000 vulnerable people for NHIH support, and we have already sponsored 66,000 households within Nairobi, and I'm sure His Excellency the Governor will surpass that target as he takes over. Additionally, NMS has enhanced provision of health, finance and medical equipment, capacity building for human resource for health, and formulation of health policies and bills to improve service delivery. On transport and public work, NMS has covered almost 350 kilometers of roads, rehabilitated over 100 kilometers of road, maintained 88 kilometers, and developed 20 kilometers of non-motorable transport corridors that is enhanced efficient transport of people, goods, and services. NMS has already constructed 3 footbridges and 5 motorable bridges to enhance vehicular and pedestrian passage, and on top of that, we have already bought 20 more new bridges, which His Excellency the Governor will install in various places. To decongest the CBD, and in line with a recommendation contained in the Nairobi Integrated Urban Master Plan, NMS has commenced the construction of 6 bus terminals outside CBD. To date, NMS has completed the construction of Green Park, Park Road, Desai Road, Westland Bus Terminus. NMS has also rehabilitated Mudhurwa, Kangemi, Hakati Bus Terminal.